Hi, I'm Dr. Craig Castanet. I'm going to talk to you today about spondylolisthesis and explain that and the treatment for it. Spondylolisthesis literally means slippage of the spine. And by that it means this, and this could occur in either the low back or the neck region. It's quite common in the low back. It's probably present in about 7% of people in the low back. Sometimes it's something that happens in childhood and you're never aware of it because it's associated with an acute injury, but the child's never x-rayed or the x-rays don't show the eventual development of this slippage. Other times it's acquired as a degenerative process in older people when the joints that restrain the normal alignment permit slippage forward. In any case, let me show you what it looks like. In the case of this low back model here, this vertebra above might slip forward like that, so that instead of these parts of the bones lining up exactly on top of each other, one may slip forward of another. Now, if that is stable, in other words, if it slips forward somehow during the course of your lifetime, but when you bend and move and do things, physical activities, it doesn't slip back and forth. In other words, if it's slipped but stable, then it's something that can usually be treated non-surgically. If, however, it's something that's slipped and it slips back and forth as you do physical activities during the course of your day, then it's probably going to be painful and disabling and in need of fusion, both to correct the alignment issue and to place it back the way it ought to be, also a little bit higher, because typically when there's translation like that, it's pathologic and it ruins the disc in between the bones, and it will mean that the disc will collapse over time, and you'll have to bring this up here, this bone up, pull it back in place and fuse it to the one below. In any case, you're going to have to fuse it to the one below. These have to be fused as one once there's a slippage there. If it is stable, however, in other words, let's say it slipped as a result of some childhood injury or even as part of the degenerative process, but it doesn't slip further during the course of your normal activities, then it is typically not treated surgically, and in fact, it's very often not symptomatic for many years or decades. But let's look at an MRI for a moment, and I'll show you what the slip looks like on an MRI scan. If you would pan over to this MRI scan, this is a low back spine right here. These are the vertebrae, here, here, there, there, there. And you can see that if you follow this up, there's a step off right here. So there's a straight line here where all the bones, the back part of the bones line up. When you get to right here, there's the slip. And you can see as a result of this slip here that over time this disc here was destroyed between the two bones, so that you don't have a nice thick disc like you do here and here. Instead, it's destroyed. This has slipped forward. This bone may or may not be stable, but what happens, and this gets rather involved, but when this slips forward, the two holes, look at this model for a moment, the two holes here where the nerve roots run down, they are no longer in alignment when this slips like that. So when that happens, it can pinch the nerves as they run down the canal. And what has to be done in a case like this, when the person is in pain and can't find relief from non-surgical treatments, this will have to be raised up, this will have to be brought back so that it's back in alignment, and these two will be fused together. Now, the rest of this gentleman's spine looks fine, so he should have a good outcome. He doesn't have a lot of other problems throughout his spine. He's got some mild degenerative changes up there. But once this problem is resolved, he should have a very good prognosis for his future and his tolerance for physical demands and activities. Surgery for this is the exception. For the most part, when we encounter these in those 7% of people, they can be treated effectively non-surgically. And the way we do that is with physical therapy, and I generally include spinal decompression as a means of treatment for that. Spinal decompression is a sophisticated form of traction. The person lies on a table. They're slowly separated. It makes a little bit more space in here, gets pressure off of the likely pain generators, the disc, nerve, and joint, and generally that's sufficient to relieve someone of enough pain that they can avoid surgical treatment. So for the most part you can avoid surgery, but when you can't, sometimes it's a blessing and the best available treatment. And sorting this out requires some diagnostic testing, MRI scan, motion x-rays where you're bending backward and forth to see if that's stable, and a trial of non-surgical methods that are the most effective at trying to avoid surgical treatment. And that generally means non-surgical spinal decompression and a series of injections to see if that can help you avoid surgical treatment. So that's the topic of spondylolisthesis. Thank you.